This special episode of Glaucoma TV will be in a very different format than usual. Glaucoma TV, the #1 information channel for glaucoma, and Fox Gym TV, the #1 customized fitness channel, decided to do a collaboration. When I see patients with glaucoma, I tell them a lot to exercise and that aerobic workout is helpful. Since I'm not a fitness expert, I couldn't give them advice on how to exercise, which was disappointing. So today, I invited a special guest to Glaucoma TV. First of all, she is a legendary fitness trainer, and she also runs Fox Gym TV. Let me introduce Dan Hanna.
Nice to meet you. I'm Dan Hanna, a trainer.
I introduced you as a legend.
That's too much.
There is a reason why I call you legendary. You went through a rough time in the past, right?
I was in a major car accident 10 years ago. I suffered comminuted fractures in both legs, and it took me 20 weeks to recover. The ligament in my left arm was torn, and I had tiny glass fragments all over my body. I got surgeries on both legs, and the rods are still there. I was told that I would have to live with the after effects for the rest of my life. Doctor said I wouldn't be able to even walk.
Nevertheless, you're working as an awesome fitness trainer now. How did you rehabilitate?
I thought to myself, what can I do here? The only thing I could do at this time was an abs workout. I did the workout in the morning, at noon, and in the evening, 1,000 times each, because I had too much time laying in the hospital bed. As a result, I got to have abs that weren't there before the accident.
There are many patients with severe glaucoma who are watching Glaucoma TV. Since they can't see well, it's hard for them to go outside to run. It's very limited in what they can do. The reason why we invited you as a guest for Glaucoma TV is because you overcame limitations and accomplished. And you are an expert who can customize exercise for these patients. And there is another special guest today. This is Hyun So-young, who is working at the outpatient clinic. She takes care of outpatient patients and plays an important role in patient care. You are also in charge of something else in the clinic, right? What is that?
For the first time at Central Seoul Ophthalmology, I organized a dance team, and I'm a leader.
You must have been surprised when you had an offer, but thank you for accepting the offer. I'm not sure about if you remember, but there was this program called The Knee Drop Guru hosted by Kang Ho-dong. When people told him about their concerns, he gave them answers. We invited you for a request. Like the knee drop guru. Glaucoma is a special disease. So I would like to talk about it a little bit if that's okay with you.
I would love that.
If you two ask me something, I will answer those and explain about it in between. Ready?
I do have a question. I've heard about cataracts a lot, but what is glaucoma? Your eye turns green? Please explain it more easily.
A lot of people get confused with cataracts and glaucoma. Cataracts turn your eyes white, glaucoma turns your eye green. The light coming through into the eye turns it into an electrical signal. This electrical signal goes to the brain, and that's how we see. A disease in which the pathway of electrical signals to the brain is damaged is called glaucoma. A lot of people relate glaucoma to blindness. You heard about it, right? Scary rumors like you can become blind. Actually, if you take good care of it and detect it early, there's a higher chance not to become blind. But there are no symptoms in the early stage. Sometimes you miss the chance and become blind.
You just said that you can become blind due to glaucoma. Does that apply to everyone?
That's not true. Even cancer has many types. Glaucoma with good prognosis doesn't cause much problems even if you have it for the rest of your life. If you don't detect glaucoma with a bad prognosis early and treat it, you can become blind. We can't detect it without checking it. You have to go to the ophthalmology and get your eyes checked.
Then what kind of treatments do patients diagnosed with glaucoma undergo?
If there is a simple treatment, it's best to treat it with simple treatment. You start with medication. However, if the medication is not an option, there is laser treatment or surgical procedures. The principle of most treatments is lowering intraocular pressure. You have to lower the intraocular pressure because it can slow down glaucoma progress in most cases. One more, lifestyle is very important. You must avoid heavy alcohol, smoking, 3 to 4 cups of coffee a day. Do you drink a lot of coffee?
I do like coffee.
And lack of exercise. These can exacerbate glaucoma.
You're saying that exercise is beneficial for patients with glaucoma?
Right.
Is there any evidence on that?
In the past, there was no evidence. Since they did research on tens or hundreds of patients, they couldn't make a trustworthy conclusion. But these days, we do what's called big data analysis. It's called the National Health and Nutrition Survey, so it's targeting tens of thousands or hundreds of thousands of people. We can analyze their lifestyles and progresses. You can see very surprising results. Beneficial exercises for glaucoma include moderate intensity aerobic activity. Even if you exercise for a short period of time, with a heart rate of 160 to 170% of the maximum heart rate, it is beneficial to do moderate or high-intensity exercise at least 3 times a week.
When you do weight training, you use strength, so it's not good to do weightlifting?
There is nothing clear about that, but I will tell you the general opinions of glaucoma specialists. When you lift weights, intraocular pressure actually goes up a little bit, but once you're done, it goes back to normal after 10 to 15 seconds. Patients with severe glaucoma or undertreatments. These people should avoid too much weightlifting. I think I should say it depends on what each patient specialist says.
When we treat outpatients, some people have joint problems, and others have different medical problems, including cardiac or respiratory diseases. Those people have difficulty choosing exercises, unlike younger people. How can they exercise?
It's a very important point. Especially with cardiovascular or respiratory diseases, you have to talk to your specialists. For example, some people have exercise-induced asthma. You have to check with your specialist before starting exercise. Joints are the major problems. When we talk about aerobic exercise, there are running, climbing stairs, jumping rope. With these exercises, you have to move joints at high speed. So you avoid those and do moderate intensity exercises.
That's my specialty.
Yeah?
Yes, because I do self-rehab. And it was fun and motivating to develop exercise. So you can do safe and fun exercise in any case.
It's very sad because patients who can't see well can't go anywhere. They can fall and injure themselves while climbing up the stairs. Not just joints, but people with narrow vision need safe exercise. First, it would be nice if they could use a gym ball or band to exercise. Second, as I mentioned, there are healthy people as well. For healthy people, they would need more active exercise. When I did a lot of exercises in the past, I did CrossFit and I injured myself a lot.
CrossFit is dangerous.
It was even for younger me. So I can't just suggest exercises with a lot of joint movements to older people because they could hurt themselves. So please consider that as well. Third, if it's too boring, you don't get to do it. It would be nice if it's fun. I was wondering if it would be possible to come up with a fun exercise that has all these requirements.
I like fun exercise. I can't stand boring stuff. But the thing is that each patient with glaucoma has a different eye condition when they choose exercise. Is there anything else I need to consider when I create exercise?
Sure. Please make one for healthy people so they can enjoy. Another one for people with joint problems. Another one for people with poor eyesight. Please come up with exercises for each group and decide which exercise would be good for each group.
I think it would be more fun since I have to consider many things. I guess there is a lot to consider, but please look forward to it.
All right, shall we wrap it up by shouting out the channel names?
Sure.
2 of us say Glaucoma TV. You say Fox Gym TV, and then say, let's go together. Glaucoma TV.
Fox Gym TV. Let's go. I didn't expect that. Thank you.
Glaucoma TV and Fox Gym TV like this.
They did a really good job.
Let me do that again. That was too long.
That's really good though.